Welcome back to my channel and welcome back to Wonder Snatch. It was Mental Health Awareness last week, okay, the 10th to the 16th of May. Kind of missed it, but I thought I'd use this to do another dermatology and drag series about psychodermatology. Alright, psychodermatology is an interface between psychiatry and dermatology. Okay, it can manifest in many different ways, so I'll be talking about that. Just a bit of a trigger warning, I will be talking about mental health and self-harm in this episode. Alright, and I'm going to do a kind of an abstract, kind of a butterfly-inspired look. A pink look for Pink Dot as well. Alright, so if that's something you want to see, don't forget to give me a big thumbs up, subscribe to my channel, and ring that bell for post notifications. Alright, let's get started. Alright, okay, so today's color scheme is going to be pink and yellow and gold and black, I think, alright? I made a headpiece, okay, for the butterflies, a bit like the butterfly challenge in season 3 of Drag Race. Remember the one where they did the butterfly headpiece as a mini challenge? Okay, and also I'm going to inspired by some abstract butterfly look by Moa Agapi, okay, really gorgeous looks she does, okay, so something like that. I didn't want to do like a mental health as makeup kind of thing, okay? I got in trouble before for doing vitiligo. And I've seen on TikTok and YouTube some people trying to do mental health disorders as makeup, and that's quite problematic. So today I'm just going to do quite an abstract, kind of a beautiful kind of a look while talking about the interface between psychiatry and dermatology. Okay, in other words, psychodermatology. It's quite amazing, right? I mean, I'm sure everyone here has some sort of experience, find that their skin responds to their mental health. Right? So when you're stressed, you get acne or your eczema flares or you get hives, you know? So in development, the skin and the brain actually come from the same thing called the neurectoderm. Huh? In the embryo, they develop basically side by side and together. So the links between the brain and the skin are really intense and really close. Alright? In fact, there's a whole field now called psychoneurodermatology, okay? How the brain and the skin interfaces. In fact, some people call it psychoneuroimmunodermatology because it also interacts with the immune system. So it's a really long word, but you know, people are starting to realize that all these things interact. Okay, I'm just going to repeat again that it's a little bit of a trigger warning, okay, this time, because I will be talking a little bit about self-harm, eating disorders, and other things about mental health, alright? So just be warned. Okay, I'm gonna pop this shirt off. Alright, okay, let's just get these things on. Oh, and I'm trying a new mic. I bought a new mic today, so hopefully that will improve my sound. Let me know how you guys find it. Just getting these face tapes on. These face tapes have lasted me an incredible amount of time. They usually break after a few uses, but these I think I've been using it for almost a year. So when we talk about psychiatric disorders, okay, they come into different categories, okay, and these are classified by what we call the DSM, which is the Diagnostic and Statistical Manual of the Mental Disorders. Okay, it's kind of like a catalog of mental disorders that's maintained by the American Psychiatric Association. Alright, and the categories are basically your psychotic disorders, okay, so things like schizophrenia, stuff like that. I know the word psychotic has bad connotations, but all it means is that it means disordered thinking, okay, like delusions and hallucinations and stuff like that. You have your mood disorders or affective disorders such as depression. You have your anxiety disorders, okay, such as anxiety. You have your obsessive compulsive disorders, and also you have things like your eating disorders or your neurodevelopmental disorders such as autism. Alright, so all these different things can manifest in the skin as well. I'm going to go into a white base today again, I think. Since it's going to be very abstract, I'm not going to be bothered with getting everything all nice and perfect. Clown white light. The skin-brain axis. There are two main ways that we can talk about psychodermatology. You have your primary psychiatric conditions, okay, and these are conditions where the main problem is the psychiatric condition and it manifests in the skin. And the skin manifestations are a direct cause of the psychiatric disorder. Okay, examples for this would be things like delusional parasitosis, where people think that they have bugs living in their skin, or things like trichotillomania, okay, where people pull their hair compulsively. Okay, I'll talk about these later. In contrast to the primary psychodermatology conditions, you have your secondary conditions, okay, and these are conditions where, well, there are two ways it can manifest. One is that you have a mental health disorder such as depression or anxiety, and these are made worse by your skin conditions such as your eczema or your psoriasis. Okay, it can happen the other way around. Okay, you have eczema or psoriasis and these get worse whenever you're depressed or stressed. Okay, or you have a skin condition that is made worse by treatment of your mental health disorder, such as some medications cause skin conditions. So these are ways that all these things interact. In fact, a bit about secondary psychodermatology conditions. Almost all chronic skin conditions such as acne, eczema, psoriasis, alopecia, all of them are associated with higher incidence of mental health disorders, okay, in multiple studies all across the board. So, whenever you do see people with chronic skin conditions, it's always important to ask about their mental state, okay, and about how they are coping with the disorders, because although most people don't have mental health problems that require treatment, okay, due to this, there is a small percentage of people who actually end up requiring some extra help. So dermatologists need to understand mental health disorders. Ooh, I love doing this white base. It's a clean slate. Okay, let's put on these face tapes so I can map out the eyes and all that. Okay, so using my Athena palette, I'm going to use this pink, but I'm going to mix it in with some white. I don't want it to be too pink. I want it a light pastel pink. I'm going to pop that into the areas of contour. This is actually quite nice and light. This is a pinkish blush. For the secondary form of psychodermatology, there are many ways this can present. Okay, so for example, some people with OCD who need to wash their hands religiously as some sort of OCD ritual may present with irritant contact dermatitis or hand eczema. Okay, some people who self-harm do cutting behaviors on their wrists, sometimes have scars or keloids, okay, that they come for treatment. Some medications for schizophrenia, such as your older antipsychotics, can cause acne. Okay, they can also cause things like diabetes and stuff like that. So I think these drugs are less used nowadays, but before they used to cause a lot of problems with things like acne. And some people with eating disorders actually have vitamin deficiencies because of the lack of nutrition. So things like pellagra or scurvy, okay, and these are basically your vitamin B and C deficiencies, can be seen sometimes in people with very severe eating disorders. In fact, eating disorders such as anorexia is one of the psychiatric conditions which are actually life-threatening. Okay, people actually die from this. So it's very important that you pick up these things, okay, when patients present with unusual vitamin or nutritional deficiencies. So it's just, you see, a very light kind of a cream base. All right. I think I'm just going to set all this with powder, alright? I'm going to be back to talk about the primary psychodermatology conditions. Alright, I'm back and I'm all powdered, added a bit of color here and there also. And I'm just going to go into powders to just give myself more dimension. I want to use this pink from New Trixie palette, okay, called Me Day. Okay, I'm going to use this to fill in my contours and everything. It's quite pigmented, good enough for my purposes. Alright, so primary psychodermatology conditions. Okay, so for primary psychodermatology conditions, the main one and the most dramatic one is, of course, as I mentioned, delusional parasitosis or delusional infestation. For psychiatric conditions that are associated with delusions and hallucinations, okay, we usually call these psychotic disorders, okay, and schizophrenia is one of them. So in schizophrenia, the connections in the brain somehow are not developed enough so that people can tell the difference between reality and non-reality, okay? So a lot of these delusions and hallucinations are actually impulses, okay, nervous impulses that arise in the brain, okay, and people can get delusions such as things like hearing God speaking to them, delusions of persecution, people coming after them, and stuff like that. It can be super distressing, and people with schizophrenia usually have no insight. They usually at the beginning have no idea that what they're having is actually a mental disorder, okay, and it can be very, very debilitating. People with schizophrenia usually at the beginning need very, very close supervision and close medical care. Okay, with medication and with training, usually they can lead relatively normal lives. Okay, people with schizophrenia are not psychopaths. Okay, completely different. Okay, and people with schizophrenia are usually not a danger to society either. Okay, a lot of people get very scared when they see people with disordered thinking because they think they might harm them. But usually, most people with schizophrenia are not a danger to society. Okay, they may be a danger to themselves. Okay, because they sometimes get so paranoid that they cannot take care of themselves. However, people with delusional parasitosis, these people have a very, very distinct delusion, okay? It does not spill into other parts of their lives. So usually they have absolutely normal lives, except for this one delusion that they have insects living on them, okay? It may have started off as some sort of feeling on the skin, like, some itch or crawling feeling, which they interpret as insects, okay? And they're so convinced that they have insects living in their skin that by the time they see a dermatologist or by the time they see a psychiatrist, they may have moved house multiple times, contacted pest control agencies multiple times, seen many different doctors, okay? And they do not believe people when they say that it's all on their head. When they present, they may or may not have skin signs. They may or may not have scratches and scars and everything from scratching, but almost never do they actually have insects. They may present with what we call historically the matchbox sign, okay? The patient will come in with a matchbox filled with stuff. They say that these are the insects that they caught in their bed or picked off their skin. And when you look at this matchbox, it's usually little pieces of lint or dust, okay? Whenever I see patients like this, I usually bring them to the microscope and show them, okay, these insects. Occasionally, they might have a bug in there, which they may have picked off somewhere, but that doesn't mean that they are actually infested. They may just have found a flea or a bug somewhere and put it in the box and say, this is what's coming off me. But, it may take several visits before you actually make the diagnosis, make the proper diagnosis. Okay, I'm going to use the color Frenemy, which is this kind of a rusty thing. I'm going to deepen up this contour here. So for patients with delusional parasitosis, you usually need to co-manage them with a psychiatrist, okay? Because more often than not, they will need medication, okay? They will need some antipsychotics such as risperidone. And after a few months of medication and counseling, and maybe a clinical psychologist as well, a lot of these patients will gain the insights, okay? They may not ever admit that there are no insects crawling on them, okay? But they may admit that the medication that they're taking do decrease the insects, do decrease the incidence of these insects. And they're quite happy to take this medication and they will ultimately lead quite normal lives. Probably gonna go a bit browless today, but I want to have this kind of like extra couple of eyes here, I think. Maybe like, something like what MUA Agape does. Using a little bit of lash lift from Trixie Cosmetics. There are other forms of delusional parasitosis. Okay, there's this condition called Morgellons, okay, where people actually think that there are these fibers coming out of their skin. There are a large number of forums and support groups out there about Morgellons, okay, but I think the consensus is that it's not really a real thing. Maybe they find the fibers from clothes and stuff and think that it's from their skin, but it's usually not. Okay, so it's another condition that's quite difficult to treat because patients never believe doctors when they say that there's nothing there. And usually these patients also might require antipsychotic medication or counseling. So I'm going for a little bit of a more butterfly look today. Hope it works. Okay, I'm just going to clean up the inside. Just making sure that this is nice and crisp so it looks like an eye. Okay, going with a denser brush. I'm packing on this pink. Okay, so moving on next to another primary psychodermatology condition. This is called trichotillomania. One of the reasons why I wanted to do this video was because I saw Colleen Ballinger, also known as Miranda Sings. Okay, she's one of my favorite YouTubers. I think she's probably one of the first YouTube videos I ever watched was Miranda Sings, okay, her singing lesson. She came out with a video a couple of weeks ago talking about her skin condition called dermatillomania, okay, skin picking. She's got compulsive skin picking where she would just pick her skin, sometimes out of habit or just to relieve stress. And this causes her to have bleeding skin, her feet and everything are bleeding all the time and it's really distressing for her. I'll link a video down below, okay, just to hear her condition in her own words. These conditions are called body-focused repetitive behaviors. Okay? Most people find it a form of anxiety relief or OCD, okay, where they feel that either picking their skin or pulling their hair gives them some sort of relief from stress. So in hair pulling, trichotillomania, people will pull their hair okay, when they're stressed, okay, and this results in bald patches that are quite irregular and quite bizarrely shaped, okay, and when you look with a dermoscope or look with a microscope, you can actually see broken hairs at the surface of the skin, okay. You don't usually see this in your usual alopecias, okay. The broken hairs are quite a distinct feature of trichotillomania. And compared to people with delusional parasitosis, people with trichotillomania have actually pretty good insight. They know what they're doing and they're actually quite distressed and sometimes even embarrassed that they're doing it. And this is where the dermatology and the psychiatry help comes in. So patients with trichotillomania or dermatillomania have what we call positive and negative emotions, okay? So what I meant negative emotions like stress and everything are relieved by picking, okay? And sometimes they have positive emotions as well. Picking actually gives them a sense of relief or gratification for, a few minutes before they realize what they're doing and feel embarrassed or ashamed. And because people with these conditions have pretty good insight, most of the time, counseling helps a lot, okay, or sometimes even cognitive behavioral therapy, okay, where they can learn new habits or stress relief to avoid doing these repetitive behaviors. Going around with the pink. Going in with another very dense brush. I'm going to try to get some other colors in now. I'm going to use my new Morphe Avani Greg palette. I'm going to use this yellow here to just give myself a bit of a yellowish blush here. Intensify the colors a little bit. Alright, so now that all the colors are laid down, I'm going to go in the shower and speckle myself a little bit with some stuff, like what Moa Gafi does, alright? Some body paints, browns and yellows and pinks and stuff, I guess. Okay, I'll be back in a bit. Okay, so I've speckled myself a little bit with a whole bunch of pinks and browns, okay, so I look like some sort of a wall or something. Okay, and now I'm going in the liners, all right? So I'm going to go in with a whole bunch of pink liners, going all around and upside down. Get my paint brushes. Okay, in a previous video, someone commented that they want me to make a comparison between the Meron and the Cryolan water-activated paint, so that's what I'm doing today. I've got my Meron on this side, okay, with some pinks here. And also I've got the Cryolan aqua colors. Okay, the Cryolan aqua colors, there's not much choice here. There's a bit of a dark pink there, so I guess I'll use that too. And on top of that, I'm going to use my Avani palette also, okay? There's a whole bunch of water-activated liners here. Some of the reviews online say that these aren't very good. They're almost as like eyeshadows which double up as liners, but we'll see, okay? We'll try all of these and see which ones are the best. So I'm just going to go in and draw a whole bunch of pink lines all around. Okay, let's start off with Meron since I use it the most. Okay, so I'm just going to go for a very marbled look. So there's the Meron. The next condition is dermatitis artifacta, okay? So these patients pick at their skin or injure themselves, but in contrast to people with dermatillomania, they deny it, all right? So they come with really bizarre kind of injuries and skin conditions, sometimes from like cigarette burns or these scratches or basically holes or ulcers dug into their skin. And all investigations turn up nothing, okay? There's no infection, there's no autoimmune condition or anything. And when these people are suspected to have what we call dermatitis artifacta, they have this compulsive need to pick their skin and cause these very bizarre injuries. Unfortunately, when they're confronted with this, they actually deny it, categorically deny it, and sometimes they might just stop coming to see you, okay? So it's very difficult to confront these patients when you suspect dermatitis artifacta. Okay, and this is again distinct from this condition called Munchausen syndrome. Okay, Munchausen syndrome is when they injure themselves and they deny it, but it's not a psychiatric condition, it's a criminal condition. Okay, and these people actually injure themselves for some sort of gain, either for attention or for insurance or for fame or something. Okay, so it's very different from most cases of dermatitis artifacta, but they're doing it out of a psychiatric condition. So that's why you need to have a psychiatrist on board for a lot of these conditions to try to tell a difference. Dermatitis artifacta has to be a diagnosis of exclusion, okay? Whenever you do see a patient with these very bizarre injuries, you have to investigate and make sure it's not some sort of medical or surgical problem before you resort to the diagnosis of dermatitis artifacta. I tend to notice that a lot of women get diagnosed with dermatitis artifacta quite early on in the diagnostic process, which isn't right. Okay, it's almost like calling it hysteria or something whenever you see women with strange skin conditions. All these abstract looks are quite fun. You can just do whatever, right? I'm going to go in with some eyeshadow to try to just blur some of these out. Also using the bottle blonde. So just shading in at the joints or something just to make it look a little bit more marbly. Okay, another psychiatric condition that we do see sometimes is body dysmorphic disorder. Okay, this has been on the rise ever since cell phones and selfies became a thing. And people are looking at their faces, people are comparing themselves to Instagram models and influencers, and people have a very unrealistic expectations of their appearance. Okay, and they do present to dermatologists, plastic surgeons to try to overcorrect sometimes, okay? I'm not averse to a little bit of plastic surgery here and there, but you know, sometimes people have very unrealistic expectations of what can be achieved, okay? And these people need to be assessed whether they have body dysmorphic disorder. Sometimes patients with body dysmorphia may also have concomitant eating disorders as well, okay? Because they have this very warped idea of what their body should look like thanks to societal messages, okay? And advertising and everything. Okay, I'm going to release these face tips a little bit just to... Yeah, so people with body dysmorphia sometimes do end up doctor hopping as well, okay? Whenever they want to get something done, for example, they want to get laser treatment to things that cannot be lasered, or they've been lasered so many times, they're getting side effects and damage to the skin, and if you won't do any more procedures on them, they just basically go on and get it done somewhere else. Okay, so it's very difficult to treat this patient because out there's always someone who'll take your money. Okay, no matter how destructive what you're asking for is. Okay, so yeah, body dysmorphia is something that we all need to be on the lookout as well. Okay, particularly in this day and age. Okay, I'm going to try the aqua color now. Okay, this darker pink, a few drops of water, and I'm going to be using a thinner brush, I think, for this. It's a bit darker. A little bit more dimension. Okay, the crayon does seem quite nice too. So yeah, it's a good addition to your kit. But it's expensive though. The Miron's much more affordable, I think. There are other primary psychiatric or even neurological conditions sometimes. Sensory problems, you know, sometimes people get very weird itches that they cannot control, okay? Sometimes these are called neurotic itch or neurotic scratching. They also sometimes may need psychiatric input for that, okay? They might need some sort of antidepressants or something to actually calm the nerves down, okay? So these are abnormal sensations or abnormal scratching. Some people with acne, okay, especially young women, sometimes have this condition called acne excoriae des jeunes filles, okay, where people just cannot stop picking at their acne, okay? And this leads to a lot of scarring and usually will require early treatment with isotretinoin. Okay, and isotretinoin, of course, has been associated with depression and suicide. Still up for debate, okay, that whether it's a direct cause or whether it's because people with acne have a higher rate of depression. But, you know, isotretinoin has been, okay, associated with some psychiatric conditions. I've been putting it off, but now let's go into the black. Okay, so I'm going to draw some butterfly wings around my eyes and then some black all the way around. Let's try the liner from the Morphe palette for this. Okay, so I'm just wetting my brush first and going in with Pre, which is this black. Didn't do anything. All right, I think for this I'm going to use this a regular black liner. Trusty old House Labs. I find that liners make such a huge difference. It's almost not drag if you don't do a liner. And always set it with black. The black in the Trixie palette doesn't look very black, it looks kind of green. Okay, and now going in and just drawing kind of like a butterfly wing. Alright, going in my Suva Beauty for this. I think Suva Beauty in the end is really one of the best water-activated liners there. Once you go into black, it's very difficult to go back. So let's just keep going. So psychodermatology is quite tricky to treat, and as I mentioned before, usually requires quite a lot of cooperation between the dermatologist and the psychiatrist. And not only that, it should be managed by a multidisciplinary team. Okay, so not only a psychiatrist, but also a clinical psychologist, a mental health nurse, a social worker, sometimes even child and adolescent services. I'm going to add some more details to that and I'll be right back. Okay, so I've got some details in there. I'm just going in with some gold, just to highlight some of these. Alright, yeah, so the multidisciplinary team is very important in dealing with patients with psychodermatological problems. Medications should always be a last resort, okay? And it's always just to help the other forms of treatment, okay? So not only do you need to look at a patient, you need to understand the mental state. Every single time you see a patient, you need to assess their mental state. And this includes looking at things like insight, how well they know their condition. Always assess their mood, whether they're having any delusions or hallucinations, their coping mechanisms, their family situation, their job situation, okay? A lot of mental health disorders only manifest, okay, when there is an issue with coping or with interfering with normal daily activities. Okay, a lot of us have very funny quirks and very funny mental stumbling blocks which do not really get in the way of normal living. Okay, so these don't surmount to mental health problems, but you know, they can be distressing nonetheless. Okay, so it reaches a psychiatric level when it actually disrupts your everyday living or your work or your relationships. So other things such as cognitive behavioral therapy, journaling, stuff like that might actually be an essential part of the treatment for these patients. Okay, in some other centers, things like self-help, relaxation techniques, social skills training, and even habit reversal are ways that we can help to treat patients with psychodermatological problems. Lips now. I think I want to do a nice bold black lip today. It's overdrawn a bit too much. Alright, so I think that's almost all I have to say about psychodermatology. I'm just gonna go off and finish this off and I'll be back with the finished look. Alright, and this is the finished look. Butterflies flying out of my brain with one black butterfly, one beautiful black butterfly there out of place. So this is my Dermatology in Drag series about mental health and skin. Okay, if you do find that anything here triggered you, or if you want to find out more information, I'm going to link some mental health resources down below, alright? Or if you know someone who might have a psychodermatology condition, have some empathy and know where they're coming from, and maybe lead them to some of the resources that I'm giving down below too, alright? And if you like this video, don't forget to give me a big thumbs up, subscribe to my channel, and ring that bell for post notifications, alright? Happy Mental Awareness Week, belated, and I'll see you next time. Bye. I made this headpiece out of printed butterflies. Not bad. It's quite stable. Check out my other videos. I did a whole bunch of Dermatology in Drag series. I did some in hair, and I did one on Ehlers-Danlos syndrome. I did an Evie Oddly tribute. Alright, bye.